So it is my great pleasure to introduce Dr. Jesse Yang. He's our Medical Director of Specialty Population Health Management, as well as our clinical lead for healthcare disparities and a practicing cardiologist at Atrius Health.
So good evening, everyone. My name is Jesse Yang. As soon as I just said, I'm a cardiologist here at Atrius, medical director of specialty pop health, and also associate medical director of quality, safety, and equity. And I wanted to kind of start off, my talk tonight just by telling you about a patient. This is a patient of mine. I'm just going to shorten his name here to Mr. H. So, Mr. H came to me initially for management of his blood pressure, and unfortunately, his blood pressure was poorly controlled when I met him. He was now having chest pain at this point. And further investigation revealed that Mr. H had likely had a heart attack at some point over the course of the last couple of months, and now his heart function was reduced in this setting. And now I found myself trying to pick up the pieces, get Mr. H's blood pressure under control, treat his heart disease in order to prevent his heart attack from potentially progressing to heart failure. And as I looked through Mr. H's chart, and what I saw countless missed primary care visits over the last 5 years. Multiple times where his blood pressure was noted to be high and he didn't show up in follow-up to get his meds adjusted. And Mr. H, like so many patients like him who miss visits and don't follow up, carries a descriptor as non-compliant in our system. There's notes, there's physicians, there's nurses, who say, oh, Mr. H, again, one of our non-compliant patients. And his non-compliance is what's blamed and led to his uncontrolled blood pressure. His non-compliance led to his heart attack. His non-compliance led to his current chest pain and his impending heart failure. But labeling Mr. H as non-compliant is simple. It's easy and it's flawed. Because I can tell you a little bit more about Mr. H. Mr. H has a family and children. Mr. H is the primary breadwinner. Mr. H has been in between jobs for the last few years as has been laid off multiple times. Mr. H works 7 days a week. Mr. H has no control over his hours, and he needed help, and we failed him. Because Mr. H isn't a non-compliant patient. He was a patient at risk because of his social situation, at risk because of his financial situation, and at risk because of his social vulnerability. And it's that social vulnerability that led Mr. H becoming medically at risk. And it's then that medical risk turned into real medical problems and real life-threatening conditions. Mr. H isn't non-compliant. Mr. H is a victim of our system. My goal here today is to challenge you to think about how we can identify and prevent disparities like what happened to Mr. H from happening in the first place. As many of you know, healthcare is reactionary. If you have chest pain and then have a positive stress test, we put a stent in your blocked off artery. If you start losing weight, we get a CT scan and find out that you have colon cancer and start treatment. While our reactionary healthcare system is effective in treating the problem at hand, what it is effective in is preventing the problem in the first place. If that patient with the chest pain had gotten good dietary advice earlier on, or gotten on the right medicines to lower their cholesterol or blood pressure, they never would have developed that plaque buildup in the first place. If that patient with the weight loss had gotten their colonoscopy years earlier when they were supposed to, that tumor they have now would have been a polyp that could have easily been snipped. Just like the earlier medical interventions that could have stopped that heart blockage or found that early cancer, there are social and medical interventions that could have stopped a patient like Mr. H from having a heart attack. The question for us is, can we identify the patients at risk early on? Can we identify the young mother who has food insecurity and provide her with the services she needs before her children show up in the pediatric clinics with malnutrition? Can we identify the middle-aged man with diabetes who's trying to find a job and provide him with the job search assistance before he ends up being unable to pay for his insulin? Too often in healthcare, we find ourselves treating the symptoms and not the root of the problem. When it comes to disparities, that root is multi-tiered, it's multi-layered, It's the product of dozens of insults and barriers from a system that is inherently unfair and racist. So my challenge to you all today is to find those patients suffering from the injustices of our system. Although we may not be able to right the wrongs of society or remove the barriers present, what we can do is try to identify those at risk and provide the assistance to bypass those barriers. What we need to do is find those individuals who need us to act now and not 10 years from now. What we must do is find Mr. H and not let Mr. H, the one that I met, ever happen. Thank you all. Good luck. And I appreciate you all so much for working on this very, very important initiative. Thanks, everyone.